I'm not going to go over how I came to the, my dream of healthcare. That's a little bit too out there, not particularly relevant.
Mm-hmm.
There are some things that have changed in the last few years that are. So of course we had the stimulus package last year and health reform this year.
Mm-hmm.
And one of the key things in the stimulus package was electronic health records, something that even under the Bush administration they said, let's make things, the records electronic, have communication between pharmacies and hospitals, so one patient record so that if one physician prescribes something, they go to the pharmacy, they're going to have all the prescriptions for that person so they're not getting duplicate prescriptions, that sort of thing. And then in health reform, which we've been trying to get in one form or another for over 100 years, the thing that is going to be relevant for folks in this group are the wellness provisions, which is preventative medicine, a little bit more diet and exercise, but it doesn't specifically cover chiropractic or massage or acupuncture or naturopathy. I can't remember if mental health services are covered or not. I know broad strokes, but I haven't been able to go in and get into the details. Other things that have happened with, even before the stimulus package, electronic health records have been developing and expanding. Last year in San Francisco, I went to a Health 2.0 conference, and in the previous 5 to 7 years or so, if you were looking at an electronic health record or electronic management system for your practice, you'd be spending $20,000 and up, and you'd be looking at hardware and software to do that. In the last few years, there are more cloud computing services, meaning that things are web-based as opposed to on a centralized network. That makes things a little bit less expensive. The individual practitioner doesn't have to worry about tech support nearly as much in their practice. Hardware is not as dedicated. You can go with something less expensive later that you don't have to replace as often, or because it is less expensive, you can upgrade to the newest technology whenever you want. So that's really brought down the price of electronic medical records, and one of the things that I saw at the Health 2.0 conference were records that were free to subscription-based. Or you could go with the traditional, install the hardware, tech support, and everything in the facility. UCSF just recently signed a contract to have theirs done. They had been with one provider, and now they've, gone with a different provider, and they are slated to be up by April with at least some elements in the hospital and education setting. With the health reform, there's a growing emphasis on preventative care so that we don't have as much diabetes to worry about, and obesity and that sort of thing. That's going to be relevant for wellness services as well, because that's one thing that we do really, really well. Social media is another thing that has changed, so that in the last couple of years, you've got some people going and using like Google Health or Microsoft Health Vault or some other personal health records that are not quite as closed as the medical record that the doctor's going to control. And then they're also participating in Facebook or Twitter and publicizing their health experiences. So that creates another wrinkle in how the medical system operates and how it interacts with patients in particular. And then we've got the various traditional business models that are going to be changing as a result of health reform. You've got let's see, the UCSF teaching hospital type situation, or traditional hospital, the HMO type setting, the Sutter or the Kaiser, which started in the mid-'80s, and personally I think that's one of the reasons for our current health situation, because of the move to for-profit healthcare on the insurance side and the provider side. And you've got traditional family practice, which I haven't been interacting with that as much, but my impression is that family practice has gone down a little bit in favor of the Kaisers and Sutters, the HMOs. And then in the last 5 to 10 years, we've got boutique and spa health practices come up, and those will include not just traditional Western medicine or cosmetic services, but chiropractic, acupuncture, massage therapy, in addition to maybe they've actually got a health spa, gym, and that sort of thing in there as well. Then you've got solo practitioners who may work in a space like this where they're renting space. Solo practitioners may have community practitioners that they work with, they may not. Solo practitioners generally are not getting paid a wage. They're getting paid by their clients. They may or may not take insurance, and then they're paying rent to the facility where they work. I know in acupuncture, at least as my training, I had a chance to look back at the laws and regulations, but there are some environments where we can be an employee, some environments where we cannot. And these, I believe, are the same way. I'm not sure how it would apply to naturopathy, but I would expect that it's similar. Some places you could be employed, get a paycheck, don't have to worry about your taxes because it's taken out of your check automatically. Just do your deductions and make sure everything adds up. But for more of us, it's a 1099 when you're itemizing everything. Taxes become much more complicated. Pay becomes much more complicated. And then on the low end, you've got low-income city clinic type services or urgent care type services. Another thing that has been part of our medical culture has been the pharmaculture. We want a pill to fix everything. I think that may be something that can change with health reform, but it's something that's been around so long, and the profit model for the pharmaceutical companies has been around and so developed. That's going to be a hard thing to change. That does create opportunities for wellness providers, and I think that if we come together and create networks, we can eventually make a presence, particularly in legislation that comes up that does reference acupuncture, chiropractic, naturopathic, and does better with mental health services, dental and vision care, which are kind of like the ugly stepchild in medicine right now. And then we also have recently the rise of folks talking about integrative medicine. That does not have a stable, consistent definition right now. It depends on who you're talking to as far as what it means. If you talk to some mental health providers, they may be talking about the mind-body connection, the mind-spirit connection, and that's what integrated means to them. In some clinical settings, you might be looking at a practice where integrated means the patient's getting services from several modalities depending on what their condition is presenting. That one I think is a little bit less common as far as how people are referring to integrated medicine. Another more common definition of integrated medicine is where someone is looking at the whole person. and trying to treat from that whole person perspective. So you can have a Western MD trying to do that, you can have a chiropractor trying to do that, an acupuncturist. But each of those individual practitioners is going to be practicing within their own modality. They're not going to be necessarily referring out to other services that might be more suited to the case that's being presented at the moment. And then we've also got alternative and complementary medicine. Alternative being most likely people who don't like the Western medical system, whether because they have had a bad experience with insurance or had a bad experience with an MD who will only spend 15 minutes with them total, even after they spend 4 hours in the hospital waiting to get there. Or you have complementary medicine, which may be used in the traditional Western setting, but a lot of times what's going to happen with complementary medicine is the allopathic provider is still going to be the one at the top, and then services are going to get referred out. Once services get referred out, you probably have patients who will look more towards the complementary service, go to their acupuncturist or their chiropractor, their naturopath, more often than they do their general family physician. But in some cases, for insurance coverage, the referrals have to go through the physician first, the primary care provider on the insurance. And that's usually regulated by the insurance plan. My understanding is that's not a state regulation. In California, acupuncturists, naturopaths, chiropractors, and MDs are all considered primary care physicians. Naturopaths and MDs can order lab tests. Acupuncturists cannot. I don't believe chiropractors can either, unless they get certifications in certain areas. Acupuncturists can get registered as qualified medical examiners, for example, to evaluate workman's comp injuries, something of that sort. So there are some minor exceptions, but complementary medicine, usually you need the referral. The model that I hope to work from is more of integrating modalities. The idea that some modalities are going to be better for specific conditions at specific times. Sometimes Western medicine is going to be most appropriate. We need the intervention, whether it's surgical or pharmaceutical. Cancer would be one example where I would definitely want to be working with a Western oncologist as an acupuncturist, massage therapist, or any other modality. For diet and nutrition, depends on what's going on, but I might refer to a naturopath. I might, as an acupuncturist, massage therapist, deal with the patient myself. Sometimes just a Western herbalist, someone who's not necessarily a naturopath, but has a Western herbal training, will be sufficient for a client with digestive issues. Or just regular nutritionists. The idea being that we all will provide different elements to patient care. And to provide the best patient care, we need to understand what the other modalities can provide, and we need to respect what the other modalities can provide. Whereas in the alternative and complementary care models, someone is at the top. If you are within the alternative model, there is generally a greater disdain for traditional Western medicine. And I have a lot of patients coming to me, even just for massage therapy, who do not want to participate in Western medicine at all. And that's problematic. Some of it's because they've had bad experiences with Western doctors, which I understand. So the way to fix that is for all of the practitioners within the system to understand how the other practices are working and come from a similar respect for the patient's needs. So that's the general picture of where I'm coming from. And after I'm done with the presentation, we'll have a chance to do a little bit more back and forth.